Sexually transmitted diseases remain a serious growing public health issue, particularly in urban environments in America. Exploring the Chicago neighborhoods of Washington Park and Englewood, the prevalence rates of gonorrhea and chlamydia can be associated directly with several key factors. The following observational study investigated age, race, gender, educational status, and income in correlation with gonorrhea and chlamydia rates in two of the most affected Chicago neighborhoods. Data collection started in 2010, gathered information from participants with the disease in regards to drug abuse, teen birth rates, and sexual education. Multiple methods of data analysis were used to prove correlation between the key factors. Ultimately, after data analysis, a linear regression model determined that generalizability could be concluded between gonorrhea, chlamydia, and the key risk factors. A community health initiative was also proposed in efforts to spread STD awareness and in turn decrease the rate of new diagnosis, specifically for the age range of 13 to 24 years old. A definitive positive trend for less new diagnosis was found after the implementation of the new community program.
Is the most common sexually transmitted disease in the United States. Gonorrhea is also a prevalent sexually transmitted disease infecting both men and women. The areas of Englewood and Washington Park in Chicago are prevalent with high chlamydia and gonorrhea rates. We propose a research study to assess the cause of prevalence in these two specific areas and to investigate contributing factors to this prevalence. We will conduct an observational study to provide a correlation between contributing factors of teen birth rate, drug abuse, and lack of education, and the two diseases of gonorrhea and chlamydia. Ultimately, we will assess the possibility that these factors can be applied as the cause of prevalence of gonorrhea and chlamydia amongst surrounding communities. This research is needed as consequences will result in increased prevalence of the diseases, possible mortality, and further spreading to newborn infants.
When looking at the statistics gathered from Chicago communities, Washington Park and Englewood, we saw a direct relationship between gonorrhea and chlamydia prevalence rates. We compared those rates to confounding factors like teen birth rates, drug abuse, and lack of education, and how it correlates directly to sexually transmitted infections. We plan to initiate a health proposal to the youth and the young adult community, primarily in elementary schools and high schools. We will incorporate sex education courses, drug abuse courses, and how they correlate with teen pregnancy rates. We will then compare how the implementation of these programs will cause the prevalence rates of gonorrhea and chlamydia to decline over time. We've decided to keep our sample size equal to the total population within each community, Washington Park being about 12,000 residents and Englewood being about 26,000 residents. 30 participants have been chosen in a random sampling group from the total population within each community, also known as a stratified random sampling model. This process ensures that we select a random sample of individuals based on their underlying characteristics from within the population. We will compare both female and male genders while comparing all races as a whole within each community. The age range that we are focusing on within this study design is going to be 13 to 24 years. We will utilize clinical and registry data for this information from the hospitals within each community. Our inclusion criteria will focus on confounding factors of lack of education, teen birth rates, and drug abuse. We will use questionnaires and surveys to collect this portion of data. All data will be collected at random within the community. We have partnered with Family Friend Health Center in Washington Park, located on 800 East 55th Street, Chicago, Illinois, as well as Planned Parenthood on 60th and Ashland, Chicago, Illinois. They will assist us with collecting data for our inclusion criteria. We will create surveys and questionnaires asking the community why they think prevalence rates for sexually transmitted infections are so high. We will also use random data gathered from University of Chicago Hospital in Washington Park and St. Bernard Hospital in Englewood, where patients have been diagnosed with sexually transmitted infections. We will also partner with community leaders, Alderman Willie B. Cochran of Washington Park and Alderman Tony Folks of Englewood. They will assist us with the proper funding for this proposal. When collecting data from within the community hospitals, this will also be done at random. We will choose a total of 5,000 patients from each community hospital who has come in with chief complaints leading to the diagnosis of gonorrhea and chlamydia. We believe that the validity and reliability of the data being collected is 100% accurate. Seeing that our information for inclusion criteria are coming from the reputable sources, community hospitals, as well as the opinions of the community residents and their views, we believe that the collected information will prove that there is a direct correlation between our confounding factors and gonorrhea and chlamydia prevalence rates.
Retrospective statistics from 2010 shows that gonorrhea and chlamydia were at an all-time high within the age groups of 13 to 24. In the Washington Park community, the females ages 13 to 24 affected with the STD gonorrhea or chlamydia totals to 22,218, while males ages 13 through 24 affected in the Washington Park community totals to 15,472, while in the Englewood community, the females ages 13 to 24 affected with gonorrhea or chlamydia totals to 20,784, while there is a total of 13,702 males ages 13 to 24 affected with gonorrhea and chlamydia.
After implementing the Breaks for Babies and Let's Talk About Sex programs in the Washington Park area in 2017, there was a significant decrease in the prevalence of gonorrhea and chlamydia, as we expected. Englewood rates showed a constant increase in both diseases. This proved a direct correlation between sexually transmitted infections and a lack of education, teen birth rates, and drug abuse. This also proves that educational programs need to be integrated into all Chicago public school systems.
To conclude our research study, it showed that there was a positive correlation between the exposures and the prevalence of gonorrhea and chlamydia in both Washington Park and Englewood. The exposures include the factors of teen birth rate, drug abuse, and lack of education. There was slightly more prevalence of sexually transmitted diseases in Washington Park, about 2% more. There was also a positive correlation between the variables in Washington Park in comparison to the variables in Englewood. This similarity in two different neighborhoods suggests generalization. One could infer that an increase in teen birth rates, drug abuse, and lack of education can possibly lead to the occurrence of obtaining gonorrhea and chlamydia. Based on the results of this study, the pharmaceutical field should focus on social and environmental factors as well as medicinal factors when creating drug targets. Further research will need to be done within other communities and populations to create a larger sample size and draw further conclusions about the prevalence of gonorrhea and chlamydia. The findings for this study can be used to show the significance in creating policies and laws that could help decrease the exposure factors in hopes of creating healthier and happier neighborhoods.